Have you considered getting dental implants, but you're just not sure if they're right for you? With all the advertising out there, it can feel like they are the one and only solution for a missing tooth. But the truth is, while dental implants are a revolutionary technology, they are not the right choice for everyone. In fact, for some people, getting an implant can be a setup for failure, frustration, and wasted money. My goal today is not to sell you on a procedure. My goal is to give you the honest, unfiltered information you need to make an empowered decision. We are going to go through the top reasons why a dental implant might not be an option for you. This is the conversation every patient should have before they commit to a surgical plan. This is your guide to truly understanding if you are a good candidate for one of the most significant investments you can make in your health. What really is a dental implant? The science of osseointegration. Before we discuss who isn't a candidate, let's get crystal clear on what an implant is and the biological miracle that makes it work. An implant is essentially an artificial tooth root, most commonly made from a biocompatible titanium screw. This screw is surgically placed into the jawbone where a tooth is missing. Then, something incredible happens over the next 3 to 4 months. A process called osseointegration. Osseo means bone. Osseointegration is the process where your living bone cells literally grow onto and fuse with the surface of the titanium, making the implant a permanent, integrated part of your jaw. It's not held in by glue, it's held in by your own living bone. This is what makes an implant so strong and stable. Once this fusion is complete, we can attach the other two components: the abutment, which is the connector piece, and finally, the crown, which is the part that looks and functions like a natural tooth. This three-part system is a marvel of modern medicine, but its success is entirely dependent on your body's ability to achieve that perfect osseointegration. The red flags, the top reasons you might not be a candidate. Now, let's get to the heart of our discussion. Here are the top reasons why, as a prosthodontist, I might advise a patient against getting a dental implant. Reason number 5, uncontrolled medical conditions. This is the first and most critical hurdle. An implant is a surgical procedure, and your body needs to be in a healthy state to heal properly. There are 2 major health concerns that are absolute red flags for implant surgery. The first is uncontrolled diabetes. High blood sugar levels wreak havoc on your body's healing ability. They impair your immune system, making you more susceptible to infection, and they damage your small blood vessels, which are crucial for delivering the oxygen and nutrients your bone needs to grow onto the implant. If your bone can't heal properly, osseointegration will fail. The second major red flag is the use of certain bone-growing medicines, specifically a class of drugs called bisphosphonates, like Fosamax or Beniva. These drugs are often prescribed for osteoporosis, and while they can strengthen bones, they work by slowing down the natural remodeling process of your bone. This can interfere with the bone's ability to heal around an implant and, in rare but devastating cases, can lead to a condition called osteonecrosis of the jaw, or ONJ, where the jawbone fails to heal and can actually begin to die. It is absolutely critical that you have an open and honest conversation with both your dentist and your medical doctor about all of your health conditions and medications before considering an implant. Reason number 4, insufficient bone, quantity and quality. This is the most common anatomical reason why an implant might not be an immediate option. An implant needs to be completely surrounded by a thick, healthy quantity of bone, just like a fence post needs to be surrounded by solid ground. When you lose a tooth, a process called atrophy begins. Your jawbone is a use it or lose it system. Without the stimulation from the tooth root during chewing, the bone in that area begins to shrink and dissolve away. In the first year alone, you can lose up to 25% of the bone volume where the tooth used to be. If you've been missing a tooth for a long time, it's very likely that the bone has become too thin or too short to support an implant. We evaluate this with a 3D cone beam scan, which gives us a perfect millimeter by millimeter map of your jawbone. Does this mean it's impossible? No. We have incredible bone grafting procedures where we can rebuild the missing bone, but it's crucial to understand that this adds another layer of complexity, time, and cost to your treatment. Bone grafting can add anywhere from 4 to 9 months to your total treatment timeline before an implant can even be placed. Reason number 3. Active, untreated gum disease or poor hygiene. This is a reason that requires radical honesty. An implant is not a magical, indestructible tooth. You can't get a cavity on it, but you can, and many people do, get a devastating form of gum disease around it called peri-implantitis. Just like gum disease around a natural tooth, peri-implantitis is an infection caused by plaque and tartar buildup that destroys the bone supporting the implant. The difference is, it can be far more aggressive and destructive around an implant. Here is my ethical stance as a clinician. If a patient is not motivated to maintain excellent oral hygiene for their natural teeth, I cannot in good conscience place an expensive and complex dental implant in their mouth, because it is setting them up for failure. People sometimes think, great, I've got an implant. Now I don't have to brush or floss as much. The absolute opposite is true. Implants often require even more diligent and specialized hygiene to keep them healthy for a lifetime. Before you invest in an implant, you must first invest in the daily habits that will protect it. Reason number 2. Heavy smoking or tobacco use. While not an absolute contraindication, heavy smoking is one of the biggest risk factors for implant failure. The success of an implant depends entirely on a healthy blood supply to the healing bone. Nicotine is a potent vasoconstrictor, meaning it strangles your blood vessels. This dramatically reduces the flow of oxygen and healing cells to the implant site, which can prevent osseointegration from ever happening. The chemicals and carcinogens in tobacco also create a toxic oral environment that is ripe for infection. Furthermore, the physical act of smoking can create negative pressure in the mouth that can dislodge the initial blood clot, a condition known as dry socket, which is incredibly painful and disrupts healing. Can you work around it? Yes. In my practice, I've had many patients use their implant journey as the ultimate motivation to finally quit smoking. They commit to stopping for a period before and after the surgery, and many of them realize how much better they feel and never go back. But you must be honest with your surgeon about your habits, so a realistic plan can be made. Reason number 1. Unrealistic expectations, the psychological factor. This is a reason that is almost never discussed, but it is one of the most important. A dental implant is a replacement for a missing tooth. It is not a new, perfect tooth. It will not feel exactly like your natural tooth did. Your natural teeth are suspended in the jawbone by a network of tiny ligaments called the periodontal ligament. This gives them a very slight, almost imperceptible cushion or give when you chew. An implant is fused directly to the bone. It is completely rigid. This can feel slightly different when you are chewing. Furthermore, the process is long. It is not a quick fix. From start to finish, replacing a single tooth with an implant can take anywhere from 4 months to over a year, depending on the need for bone grafting. You must have the patience and the commitment to see the process through. If you are looking for an instant solution, an implant is not it. It's crucial to have an in-depth conversation with your prosthodontist about what you can realistically expect in terms of feel, function, and the overall timeline. So, as you can see, the decision to get a dental implant is a complex one. They are a fantastic, life-changing technology, but they are a successful tool only for the right patient in the right situation. The purpose of this video was not to scare you away from implants, but to empower you. You now have the knowledge to have an intelligent, informed conversation with your dental provider. You know the right questions to ask about your health, your bone, and your habits. You are no longer just a passive patient. You are an active partner in your own healthcare. Thank you for joining me on this deep dive. If this video has given you the clarity you were looking for, please hit that like button and subscribe. And if you have more questions and would like to find out if you are a good candidate, click on the link in the description to book a consultation. We would love to help you find the best plan for you.